That right there, guys, is worth the entire show, because you could chew on that and think about your situation and what about your food, what about toxins, what about your thoughts, what about your movement patterns are affecting how you're feeling today.
If all of that is handled, you'll pretty much be in remission.
I love it.
If you don't get in remission, there's something you have likely missed.
All right, everybody. I'm so glad that you're tuned in to the Dr. Chapa Wellness Show. I am so thrilled to come and teach people how to live better, be better, and stay better one bite at a time. We know that all life starts and stops at the cellular level, and nutrition drives it all. And every week that we come into your homes, we want to teach you, educate you, and help you understand what it takes on your end to make the right choices. And I want to bring some of the best education to you that I can find. And one of my favorite friends, Dr. Patrick Krupka, is come to hang out with us today. Dr. Pat, tell us a little bit about you, where you're from, how long you've been in practice. I'm going to tell them a couple stories on my end, but I just want you to I want them to get to know you too.
Sure. Yeah. First of all, love hanging out with you. I mean, we are far enough apart from each other that we don't get to hang out in person as often as I would like, but always a good time when we do. So, and when we can do it, when we're not going to mess up somebody else's seminar by goofing around, then that's
middle of class. This is our seminar.
Way better.
We get to totally just roll with the cuff and have some fun.
So, I graduated from chiropractic college back in April of 2000. So I've been practicing basically chiropractic and functional medicine well over 24 years now. And it makes me sound kind of old to say that I do, but I actually got out of chiropractic college knowing that I wanted to do nutritional and functional medicine. Went straight on in, and that's what I've done ever since. I'm out on the north side of Houston. But basically, when people ask what I do and what I see, it's everything you would see your family practice doctor for. We just don't use drugs or surgery.
That's cool.
Right. And I've never been able, I'm assuming it's the same for you. I've never been able to specialize.
That's right.
Practice management people tell you, pick a niche, do one thing, only do autoimmune or only do sports nutrition or only do liver problems or whatever. And I've actually tried that a couple of times.
It's stressful.
Because lo and behold,
somebody
there
comes
are things attached to that liver.
That's right.
And so, yeah.
People come in and their big toes turning blue. I mean, you got to help them figure that out.
That's right. And whether you're a liver guy or a sports nutrition guy, their toe is still blue.
That's right. So you better have an answer.
So I've never niched down necessarily. So yeah, it's basically anything that goes wrong with people. I'm the eternal optimist, and I'll always roll my sleeves up and give it a try.
Here's one of the things that he just said that I get fired up about is he's going to give it a try. He's an eternal optimist, which means he believes foundationally that the innate intelligence that God gave us, that the body will heal itself. So anything the body can develop, essentially, it can undevelop. And I think that is a very powerful message in and of itself that we could just sit and relish on. And I remember when we were in school, he was one of my first teachers. Somehow they roped him into teaching. It was a blessing for me. I think he gave the school a run for its money because he was a outlier for sure.
I was not their favorite.
No, not their favorite. That's a good way to describe it.
The students liked me. I'm not sure the admin did.
Yeah, but I'll tell you, and the reason that was the case is he didn't fit in this mold that the world says we got to niche into. And the reality is guys, when it comes to health, when it comes to symptom patterns that you weren't genetically born with, anything your body can develop, it can undevelop. You just need somebody to guide you through the terrain. And that's essentially what I heard you just say.
Yeah.
And I think it's awesome.
I tell patients all the time that most of what you have is an adaptation that your body's made to try to deal with something in its environment that's not the way it should be.
That's
right?
Right.
Your body, I mean, we're very complicated. Right. It's definitely, as a human species, we're complex. We're not earthworms.
That's right.
You know?
That's right.
And so, so maybe
inchworm.
There are a couple of exceptions, but generally speaking, we're not. But when you look at a complex system like that, a lot of things have to be lined up right for that system to work properly. I mean, you know that as well as I do, because we try to live in a way that our bodies can function really well.
That's right.
We're the example.
That's right.
Because it's what we do for a living. But if some of those things can't be in place, if you're not eating the right stuff, if you're not moving the right way, you're not sleeping the right way, your body has to try to adapt to that to survive. Sometimes those adaptations can be diagnosed as diseases.
That's right.
And you don't necessarily need to treat the disease. but you need to get rid of the situation that necessitated that adaptation. And and I'm getting ahead of some of this, I know, but that's something about functional medicine. And different doctors do the same thing and call it naturopathic medicine or clinical nutrition or holistic, whatever. It's the same principle. It's not about treating disease. It's about using that disease to recognize where a process has gone wrong in the body.
A chink in the armor.
And then as a clinician, you need to know which organ or gland is responsible for that process. What tells that organ or gland what to do? What does it need from your environment to do that? What nutrients, what proteins, what sunlight, what sleep? And by understanding that, you can get that organ or gland
back
to work
online
the way it's supposed to again. And then that adaptation, those symptoms, they go away. You never treated the disease. You treated the patient. You used the disease for information.
That's right.
Right? It's this big "you are here" sign pointing to where the problem is, but you knew enough to treat the body and clean up the environment for that person. And that's what we do all day.
All day. And guys, hearing the message is we listen to the body. We're listening to the symptoms that you come in with, but we're looking past that to find where the system is breaking down. And so that we can kind of set the tone for the stage, because him and I have so much to share.
We
could literally do this for hours and hours. And I'm sure that you guys would love it. I'm sure I would love it. He would love it. And but we want to create like we're going to niche down a little bit and see if we can talk to some topics for you guys that his clan of people and my clan of people have asked us specific questions they want more answers to. And so on today's wellness show, we're going to be talking about autoimmunity. And so I'm going to be drilling him with some questions that you guys have given us, and that, what we just kind of spur up into common dialogue. We don't need pieces of paper, but, people like to try to hold me and refine me so that I don't like run off the rails. So forgive me for the papers and the hard knocks. But here's the reality, guys. Like, this is exciting. We want you to have tools, resources, understanding, because when you master the disease, the symptom patterns of autoimmunity, for example, the disease goes away. The disease is healed, and that is something I think people need to remember is it's just a name. And in my world, I'm a full believer, all these names bow to Christ. And our job is to get in alignment with how he created the system to work. And when you don't have things working appropriately, what can we do to fix it? And that's where you need guidance. Somebody that is a straight and narrow path, somebody that's a compass that's going to help you navigate the terrain.
Well, and not just the terrain, and I don't want to get too far off into this, but these patients are also being given a very different message
in the Western world
from other practitioners who deserve some respect, right? I mean, they're good at what they do.
But they're specialized.
For many people, what they do is not what this patient needs. If I break an arm or have a heart attack or, they got to cut my leg off for MRSA, I'm not coming to me.
That's right.
Right? But when I have a chronic illness, I come to someone like this, because prescriptive medicine that's not what they're geared toward. I mean, they do it, but they do it in a
very poor way.
They really do.
Over-medicated.
Yes. Well, it's like trying to be a watch repair person, but you've got mittens.
Oof.
That's kind of what they do. They can open it, but it's not going to be pretty.
It's not going to be pretty. And they're not going to put it back together.
Get a hammer and open it.
There might be something left when they put it back together, too.
Yeah, it's unfortunate. But these patients are getting that message, and then they come to us, and we not only have to kind of answer to that message, but then give them, what we believe is really the truth.
Well, speaking of the watch model, like when you look at autoimmunity, like that is kind of a buzzword that's kind of flying around the last 10 years or so. And I still think that, again, Western medicine seems to have a way of pigeonholing a diagnosis to a drug.
Oh, yeah.
And autoimmunity is often misunderstood, and then it's not translated well, as you said, to the patient. What is autoimmunity? Why is it on the rise? And what is it? And why is it on the rise, you think? I mean, like, what's magically happened in the last, several years, 10 years, 20 years that have allowed this to make manifest?
Okay. I'll try to condense this.
I know. It's difficult.
What is it is not all terribly complicated. I mean, in a nutshell, something tricks confuses, disorients, whatever, your immune system, and your immune system attacks some of your own tissue as if it were a foreign invader. Like, we need our immune system to be absolutely Army Rangers, Navy SEALs about destroying incoming threats. But if any of that gets directed at our own tissue, then it has to be stopped. Like, you don't want to be that good at killing things and then turn that on yourself.
That's right.
Right. So an autoimmune condition is simply when your immune system gets some sort of intel that says, no, that thyroid is what I need to be going after. Right. And then it does that damage there. The trick for us is, how did that happen? Right. How do I untie that knot? How do I reprogram that situation?
And autoimmunity can happen not just in the thyroid, but anywhere.
Anywhere. So and this will make sense if you'll bear with me for a couple seconds. The way I describe it to patients, if you and I were sitting here having this conversation, and some people don't like this analogy,
I'm sure it's going to be great.
It's the best one. Okay. But if we're sitting here having this conversation and we were to set a pistol on this table right here, and the whole time we're talking, it just sits there, nothing's going to happen.
Right.
If bad people come in the door, one of us could take that pistol and do the job, right? It's there. But as long as we don't touch it, nothing's going to happen. Now, two things have to happen for that pistol to do any kind of damage. Number one, it has to be loaded. And number two, something or someone has to pull the trigger.
That's right.
Right. So in the analogy with autoimmunity, if that pistol is a useful part of our immune system, we could defend ourselves with it, right?
Yeah.
If the genetics of any particular person has loaded that pistol, now there's a bigger threat because it's loaded. Let's say genetically you're prone to having a gluten sensitivity, right? Okay. That loads the pistol. Let's say genetically there's an enzyme you can't make in the liver that would detoxify a certain chemical. That may load the pistol. Okay. Now, if you never come in contact with the chemical,
you don't ever
nothing
pull the
ever
trigger.
happens, right? Nothing messed with it. Now, our environment, we can't really change the genetics. We can't. Apparently Pfizer can, but we can't. But it's a different discussion.
That's right.
So the pistol sitting here, it's loaded, let's say, or presumably loaded. The problem that we deal with is what's fiddling with it. If I'm absent-mindedly flipping it over and turning it over the whole time we're talking, I'm messing with it, everybody watching this would be uncomfortable.
Yes.
Like, he's going to shoot Aaron, and we don't want that.
We don't want that. No, please.
Now, the medical community names autoimmune disorders by where that errant shot would hit you. If it hits you in the shoulder versus the hip versus the wrist versus the nose, they're going to name each autoimmune disorder differently. But you and I would agree that the mechanism of damage
is the same.
Is exactly the same in every one of them.
That's right.
Right? I'm not going to go put a little bulletproof pad in front of all the different places that might get hit. I'm going to say, quit messing with the gun. Because if you quit messing with the gun, it can't go off.
That's right.
We can't unload it necessarily, but we can quit messing with it. So our job is to run through a list of predictable manipulators of the gun and get them out of the way. Because if you quit messing with it, you go into remission. So you didn't cure anything.
That's right.
But you go into remission. If you mess with it again, it'll go off again.
So why do you think we're seeing so much autoimmunity diagnosis? Why are these errant bullets being shot at different tissues? Like, and what?
It's up to you if you want me to do this now or later. But if I go through a predictable list of things that mess with the gun, you will notice that a lot of the things on that list are more problematic now than they were years ago. And I could go through just the couple of heavy hitters.
Yeah.
Right. I have
top 3.
I haven't talked about this in public. Exclusive for Aaron. In my office,
y'all hear that?
I use what's called a fix anything protocol. It's an acronym. It spells, the first acronym was fish melting, but it didn't work. I had to rearrange things. I got fix anything. So on that list, the heaviest hitters, food and intestines are first.
Food and intestines.
Food reactions, intestinal infections, leaky gut. Probably 70% of what we see autoimmune-wise is dealt with right there.
Yeah.
Right. Hormones are on the list. You've got thyroid hormones, gender hormones, adrenal hormones, and then hormones surrounding blood sugar, right? And then toxicity, and I would say immune system. Now, immune system, I have to explain for just a second. We're dealing with immune system. That's obvious, right? But I'm talking about spyware in the immune system. Cytomegalovirus, Epstein-Barr virus, Lyme disease, Lyme co-infections, mold exposure, things that aren't necessarily obvious like strep throat, but they're in the immune system, and it's like spyware in your computer. Things get glitchy, things don't work well, but there's no window open that says I'm messing with your computer.
Right.
It gets hidden in the background, right? Those are the ones that I would say are tops in my office. I'm sure it's what you find all the time too. But if you look at food quality, intestinal infections, spyware in the immune system, toxins, hormones, they're way more messed up than when I started in practice 20-something years ago. Why? Food stinks. Our food supply is terrible.
I remember being in a seminar with you. I had you come down and help us with a detox class we taught many years ago, and you said something, and I've sat with me for years, which was, and I've said it, but I never truly understood it, and for whatever reason, it just clicked that night. But we've always heard you are what you eat.
Yeah.
Or I like to change it, you become what you eat. If you want to become a sugar-filled lump of dough, eat sugar-filled lumps of dough. If you want to be fresh and vibrant, eat fresh and vibrant foods. I saw what you just did there. That little inside joke.
Uh-huh.
But when he was at the seminar, he mentioned to the people that, guys, what you see before you is a product of what I'm putting in my body as a resource. So if I've been eating a lot of processed toxins, high fructose corn syrup, deadly food additives, seed oils, all of a sudden, those start making presentations on the body in some capacity, whether you're swelling in your head and you got headaches for a living, or you have heart palpitations, or you have overweight, obesity. They say a lot of times all the chairs in the airports, the chairs on the airplanes, the chairs in the movie theaters have all expanded because humans have expanded over the last 100 years.
I would simply say, and this is a version of what I said at that class we did.
Oh, you remember? Good. I can't wait to
I
really get it.
I am about 184 pounds more than I was when I was born. Where did that 184 pounds come from? I don't photosynthesize, right? Much as I try, I don't. So that 184 pounds came from what I'm putting in my mouth over the 36 years of my life. No, I'm 54. So for most of my life, I have been feeding myself.
You're a beautiful 36-year-old.
Thank you very much.
Yes.
I've been feeding myself what has become this Adonis of a body that you see in front of you now. But that's the reality of it. Whatever you weighed when you were born, subtract that from what you are now. That's what you ate.
That's what you ate. And your body's
Do you
evolved.
want to build that out of duct tape and cardboard, or do you want to build that out of bricks and mortar and things that were designed
Well,
to be
it's interesting you
blocks?
say that, because they say that right now there is more nutritional value in the cardboard box the cereal today is coming from than there is in the cereal that is in the box.
Yes.
I mean, what the heck?
It's
like you said,
ridiculous.
food is terrible.
Oh, terrible.
Or so hit that acronym again. So fix anything.
Fix anything. Food and intestines are first. Toxins, that's the X. Abnormal mitochondria, nutritional deficiencies, thoughts, trauma, history, integrity, spirituality, all of the emotional stuff is under T for trauma. Hormones. Then we have immune. We have neuromusculoskeletal. Got to get adjusted. If the brain can't talk to the rest of the body, the organs can't work the way they're supposed to.
That's true.
Right? We want it to detox and heal and repair, but without instructions, you've got to handle that.
I say if the dude don't move, the dude don't groove.
Exactly.
Yeah,
and then the last letter is G, which is glycemic control. That's the blood sugar component.
Beautiful. Wow. That right there, guys, is worth the entire show, because you could chew on that and think about your situation and what about your food, what about toxins, what about your thoughts, what about your movement patterns are affecting how you're feeling today.
If all of that is handled, you'll pretty much be in remission.
I love it.
If you don't get in remission, there's something you have likely missed.
All right. So what are some early signs that someone might be developing an autoimmune condition? And what are maybe some even tests or something that people should be doing regularly before the engine breaks?
Yes.
Before you're broken on the side of the road.
So all about prevention. As far as symptoms go, it's going to be variable because the symptoms are determined by where that bullet hit you, right? You're not going to have a symptom of me messing with the gun.
Right.
You're going to have a symptom when it hits you. And so the symptoms are all over the place. Many times it's going to be, I have dysfunction here, and my family doctor can't tell me why. There's no obvious, I don't have strep throat, right? There's no obvious problem like that. And it's not rectified by a simple, eat more protein, whatever. If it persists, there's a good chance this is autoimmune. As far as prevention, which I prefer, and honestly, the prevention you do is really not any different than the treatment that we do. You're just doing it ahead of time, right? You're doing it before you need it. But it's going to be eating real food, taking care of the gut, making sure your hormones are balanced, living by your circadian rhythms, getting movement. Living by circadian rhythms is like go to bed when it's dark, wake up when it's light. Some version of that.
Yeah.
Right?
I think though people sometimes they have symptoms, and now that we live in the information age, they have a hard time differentiate just like why would a person have a headache, for example, versus it being a cancer or being some sort of, like how do they know that it's a problem?
Age-old question. People come in all the time, and you get it too, I'm sure. Things like headaches. I have a headache. Okay, we'll try these couple of things. Maybe it's structural. Maybe it's blood sugar. Maybe your eyes are strained, whatever. So we hit the quick things first. If the headache goes away, no harm, no foul.
Yep.
If we run through the quick things and it doesn't behave like we would expect,
then
that's where the clinician starts to come into the picture and say, okay, wait.
Something's wrong.
If it was one of these normal things, it would behave this way. It's not behaving that way. What are the other things that it could be, right? But I have patients ask me all the time, is there a test you can do to see if I have cancer somewhere? Not really. I mean, you can look for certain tumor markers, but they're not great, and they don't encompass all the cancers.
Yep.
You can go do a full, like Tony Robbins and his crew are now setting up clinics that do these full body MRIs, which I think is super cool.
I do
if I
think
could
it's
afford
cool.
it, I'd go do it. But if it's small enough, you're not going to see it.
Yeah.
You're not going to see blood cancers on that, right? Because that's not a mass.
It's not a mass.
So there's no great way. What you need
Isn't that interesting that we're at a point in life, though, where we are at least recognizing if we can see a mass earlier, that's a good thing. But how often do you find that, like, if they even saw the mass, is it really a problem? Or is it just one of these glitch in the matrix, like the stomach chink in the armor is clogged up, the liver backs up, the lymphatics back up, and then you get this slowing and this congestion on the freeway, so to speak. And simply put, they see it, but if they would do regular detox or if they would change their diet, all of a sudden that clog goes away and the mass just washes out. I mean, that's possible, right?
Oh, 100%. But and this is pulling back the curtain a little bit here. As a clinician in this day and age, you have to work with the patient under that assumption, right?
Yes.
That, hey, this is another manifestation of the body not working properly, right? But there's an acknowledgement that sometimes once these things get started, it's a runaway train. And if you don't get in front of it, it gets out of control.
Which is why they want to do the testing.
If you find it early, getting your body under control makes way more sense. But when you don't find it till farther down the road, that train's going 80 miles an hour. Well, and they're asking you to step in front of it. It's a
come on,
it's a
Superman.
right?
Well, but it's interesting though. Like I wonder how often though, even when they find something, we fear the unknown, jump to conclusions,
Sure.
and really it wasn't maybe a speeding train. It was simply just a chink in the armor. And it's showing up, right? But lifestyle practice still could fix it. And,
Yes.
and they're sold a bill of goods, I think, in the medical world right now where, I mean, they're scared into the system. And then they go down these roads and they're not taught wellness. They're not taught toxins. They're not taught gut and food. They're not taught, how to think better about the situation. They just fear. You got to move quick. You got to knock this out. And it's to cut is to cure, or whatever the model is going to be.
And unfortunately, there's a problem in the system where, because of the model that they have set up that they work by, there's information that you and I don't have access to. For example, I have a patient, she's in her, oh my gosh, late 80s at this point, and she's had breast cancer for probably the better part of the last 15 years, right? She had it before, went away through regular treatments, came back 10, 12 years later while I was seeing her. And then she basically told me, I'm not doing conventional stuff, right? So you do your
You're
thing.
my guy. Yeah.
If I go, this is what I'm doing. And she's had it all this time. Still with us, still driving around, doing her thing, fully
Praise God.
functional.
That's awesome.
She's got issues and it's still there. She has cancer, but it's not doing much. It's staying local, it's a nuisance, and life goes on. But then I've had other patients where they find it, and within months, it's all over the place, and it's very aggressive. The medical community doesn't really care much about figuring out who's who. There is no testing out there to try to determine who's the slow smolder, who's the bonfire, right? All this. If we had that information, we could behave differently with these patients. They don't need the information, so nobody develops a test for it. And so we're left to some degree flying blind.
Yes.
Even like if someone said, which herb is best for my kind of cancer? I mean, here's a list of herbs that we know have anti-cancer properties.
Yeah. Burdock.
What's going to work for mine?
Yeah.
Right.
Cat's claw.
We don't have that kind of information.
That's right.
Nobody has taken various different cancers and
ran them
tested them
against
with a bunch of different herbs to try to figure that out. They do it with chemo drugs, but they don't do it with herbs. So
Well, you know why that is.
Oh, I know exactly why that is. But we're left dumping the Mack truck into the back of these people, trying to, okay, we'll just give you everything.
That's right.
Because we aren't allowed to get the kind of information we would need to be more specific with what we're doing, right? So you look at cancer generally as this person's immune system has gone wrong, the metabolism in the cell has gone wrong, the mitochondria aren't healthy. How can I try to put this back together?
Would you say autoimmunity is sort of like cancer, or are they completely different?
I wouldn't say they're completely different. But I certainly think the dysfunction goes one direction with autoimmunity and one direction with cancer. I mean, to me, my personal belief, cancer is a metabolic disease.
Death of the mitochondria.
19 times out of 20. Yeah. The mitochondria don't function well. They slip into this survival mode. The cell does nothing but metabolize sugar and reproduce. And that's, now you've got this going on.
I think where the similarity, though, it sounds, is based on the earlier definition of autoimmunity, is now the immune system sees the body as a foreign invader, same as it's seeing a dead cell or a cell malfunctioning, and it goes to attack that. And essentially, it's the immune system's response to dysfunction. And if we can get and feed the body differently, like I would imagine, like what would be your first line of approach in dealing with an autoimmune case? What would be your first line of approach in dealing with a cancer case?
I would say the biggest difference is the sense, and I'm saying that carefully, the sense of how much time you have to make a change. In the autoimmune case, the sense is I've got a little more time. We can methodically work through a process. In the cancer case,
it's got a death sentence.
Even if it's just from the patient, it's got to happen today.
Yeah.
Something's got to change.
But isn't that
get
good?
It right
That's
the
good
first
marketing,
time.
though.
Oh, it's great marketing. It's great marketing.
I was talking to a breast cancer specialist.
There's more time than they think they have, right, to make those decisions, but not quite what you have when you're dealing with autoimmune stuff.
I see. Well, it's just interesting because, like, I was told the other day, I was asking a breast cancer person that works at a hospital, has it been busy? And they go, no, but it will be. And I said, why? Oh, it's Breast Cancer Awareness Month. So
everybody gets screened.
Everybody gets screened, and then they see something, they flip out, they get a C word, it's a death sentence. Whereas if it was just, hey, look, there's some abnormalities, and let's start lifestyle practice, and then come back and reevaluate.
You and I have both probably had the experience where someone comes in and says, "Oh my gosh, I found a lump."
Yeah.
Right. What do I do? And we have a conversation, and they say, okay, I'm going to go home and pray about this, think about this, whatever. I'll make a decision. I'll see if I want to go do the mammogram or the biopsy or whatever. And then I say, well, while you're making that decision, let's go ahead and do these few things, right? Let's make these changes while you're making that decision. And we've had patients where by the time they make the decision, they can't find the lump. We don't know what it was, right? Could have been, could have not been.
Well, like we said earlier, it could be just a clog. It is a lump, essentially.
Could be a cyst, a clogged duct, could be all kinds of things.
Yeah.
Or it could have been cancer. If you make the change early enough and the problem goes away, nobody finds it on the mammogram, great, that's a win. What game did we win? Not sure.
Yeah.
But we won.
And we're
we
thankful.
move on.
That's right.
Right. And so yeah, were some of those probably cancer? Probably. Were some of them not? Yeah, probably.
Well, the body goes in and out of cancer
Oh, I would think so. Yeah, regularly.
all the day long.
Yes.
And then the body's immune system.
I do worry a little bit about the new, they're doing what are called liquid biopsies now. There are some blood tests that are coming on the market where they draw the blood, they sift through it and look for any kind of random cancer cell, and then they type that cancer cell and say, okay, well, you've got a breast cancer cell floating in your bloodstream, so there must be breast cancer in there.
So maybe preoperatively or preemptively.
So at least very, very early.
Well, remember one of your messages in the Fix Everything was the mindset.
That's right.
Mindset's everything. If I told you had some sort of autoimmune gene issue, if you had some sort of cancer gene floating in your blood or a cancer cell floating in your blood, then I now have this, oh my gosh.
I have cancer.
That's right.
I'm a cancer patient.
That's right.
Yes.
And that is a very powerful thing to make sure that we don't fall victim to, is the power of the mind. So how do you help people recognize these tests are cool and valuable?
It's tough.
But you can't take it lock, stock, and barrel.
I won't tell them to ignore it, right? I'll tell them it's all data. I never mind having data. I'm a data guy. I love data, right?
Yes.
But you have to frame the data. We don't know how often you have a prostate cancer cell that floats through your bloodstream, your body recognizes it, deals with it, it's all gone,
Yep.
No harm, no foul. There wasn't a time where we tested that and said this percentage of the population on any given day has a rogue cell.
I think I know the reason. The reason is we live in a culture where it's what do they say? Ready, fire, aim. But we are in the business of aim, fire, ready.
Yes.
So we jump to a conclusion of emergency, DEFCON, whatever, as opposed to, all right, we see data, we're evaluating what's your lifestyle been, what's your stress load been, what's your digestive health been. I mean, I had a cancer patient come in just the other day, and they're winning. They're doing really well.
Mm-hmm.
But interestingly enough, they're not pooping every day. They're not pooping before 10 a.m., and they're not having 2 bowel movements a day. So their body is not eliminating well.
Yeah, there's still an issue.
There's still an issue. And these people are seeing, quote unquote, the gurus of the world, and these gurus are missing it. 12 years ago, I went to see a cancer patient in the hospital, and she hadn't pooped in 2 weeks.
Yeah.
I hate to say like it's just always is that simple, and it's not always that simple as a bowel movement, but
she'll do better if she's pooping.
Yeah.
I mean, is that going to cure the cancer? Who knows? But she'll do better. One quick thing I want to make, a point I want to make, I'll be real quick about it. Understand as a patient, and sometimes as a clinician like us, we need to understand this. I was a paramedic for years before I did all this. In the allopathic or the prescriptive world, you want to deal with the most life-threatening issue first.
Okay.
And then work your way back to the mundane. In our world, we work with the mundane more frequently.
Yes, right.
And if that doesn't behave the right way, then we get into the life-threatening stuff.
That's right.
And those are two different mindsets. And we keep getting forced to play their game because patients come in and say, "Oh, I've been told this. We gotta run at this." And we all of a sudden go into emergency mode.
That's right.
Which sometimes needs to happen. But our general method of practice is to deal with the mundane first. So those are two very different mindsets, and there are pros and cons to both.
So this is where I like to say all life starts and stops at the cellular level, and nutrition essentially drives it all. The gut lining, as Pat said, drives it all. Recognizing food quality drives it all. Your choice, it's your life, your health, your choice drives it all. Whenever we're talking about immune system, whether we're talking about autoimmunity, whether it's cancer, we in this realm of thought of functional medicine want to teach you to look to the simple things first. Appreciate the data that you gather, bring it in, but don't get lost and scared or fear tacked into doing something extreme, barbaric, when it could be as simple as, are you doing the basics? Are you addressing the inflammatory foods you're putting in? Are you thinking about this word toxin and going, well, what is the toxins in my home? What are the things I'm breathing in? What are the things that I'm eating? What can I do to control my environment? There's so many things. What can I do to think better? And surrounding yourself with people that are not, jumping to the extreme conclusion is how you to rationalize your approach to the situation, to recognize, do I need to move fast, or do I recognize that this is a piece of data and I need to evaluate, but I don't need to jump off the cliff and trying to run from it and potentially hurt myself or end my life, span faster than it needed to be. And, Pat, I love this topic because people they live in fear a lot.
They do.
And I think that the message that we're trying to give you guys is that you're missing the mundane thing, the bowel movement every day, the better sleep, the food that you're eating, and you're being scare tacted into doing something extreme when the diagnosis shows up instead of taking a deep breath, consulting with somebody that looks at things through a different lens, taking all the data in yourself, then going and praying about that and asking the Lord to give you guidance and direction.
Everything in our environment right now is fear-based.
That's right. And
because
I think
it causes the change they want. Think about what you would do if you all of a sudden got diagnosed with something scary. Make those changes now. Don't wait until you get diagnosed, and then you won't have to deal with it.
Had a guy yesterday tell me, he goes, if we operate, what's fascinating, he said, if we operate out of fear, it's always going to come out sideways.
Oh, yeah.
Ooh. I go, ooh, that was uncomfortable. But he goes, if you operate out of love, it's things work out way better. And so remember that. Be kind to yourself. Be good to yourself. Eat well, live well, sleep well, play well, pray well. Be intentional with everything that you're doing. But understand, it is your life, your health, your choice. And we want you to see the truths and appreciate the power that you have inside your own choices to make your life count for something amazing. So glad you guys tuned in today. We are so thankful for you, Dr. Pat. Thank you so much for just being a part of this segment of the show. The Dr. Chapa Wellness Show is just evolving to a place where I want to be around people that think like you all the more, because we are a niche community. So in a sense, we are niching down by bringing specialty in that think differently, because the world is telling us to do it completely different.
Oh, yes. Yes.
So
thanks for having me. And thanks for doing this.
Absolutely. God bless you, man. And God bless you guys. Y'all have a blessed and wonderful day. And we'll see you on the Dr. Chapa Wellness Show next time.